My name is Adeyemi Johnson. I am an interventional cardiologist, which means we open up blocked arteries and fix things in the heart, going through small tubes. So we don't actually cut open the chest or the heart, we go through small tubes, sort of like minimally invasive surgery of the heart. My initial training was in the University of Lagos many years ago. I went to the US for my postgraduate training, where I did my internal medicine at Columbia University and then did my cardiology at Loma Linda in California. Came back, I spent 28 years in the US, came back 10 years ago to set up First Cardiology. At the time I came back home, there was nothing called invasive or interventional cardiology in Nigeria. And it was my determination to bring that kind of service back home. Like I keep telling people, if you go to the US or to the UK and you ask for the top 10 doctors in any subspecialty, you will find at least one or two Nigerians there. And I felt it was a shame that there were all of us over there and we couldn't do anything back here. So I decided to come back home and start this program. Now I can tell you that this was my bedroom. In this building, this was my bedroom. I got this place and lived here, started working out of some hospitals, St. Nicholas and Reddington. Then slowly the practice got bigger, and now I had to move out of here, turn this into a hospital. And you will go around later on and see how big the hospital is. We started out from no beds to now we have 17 beds, including ICU, operating theater where we do open heart surgery and other types of surgery, and something called a cardiac catheterization lab where we perform the angioplasties and stents, pacemakers, and those type of procedures. So that is it in a nutshell. We are growing, and we are no longer doing only cardiology and cardiac surgery. We are expanding to other subspecialties. So in a few years, we will become a fully fledged multi-specialty hospital. We don't do much of primary care, we do mostly specialty care. And that is what we intend to do. We started doing orthopedics, laparoscopic surgery, and some neurosurgery. So we're slowly expanding and we're concentrating mostly on adult care for now. Later on we will start pediatrics, but for now, adult care. Well, as of now, I believe 90% of cardiology and cardiac surgery can be carried out here. There's no need to go abroad. Things you need to go abroad for now are for heart transplant and some other advanced procedures we do not have here yet. But my intention is in 4 or 5 years' time, we should be able to start doing heart transplant surgery. And that is where I see us going. But my aim is to make sure we are no longer victims of medical tourism and all our patients go abroad. That time has come, that time is past. We need to start bringing patients from around Africa back to Nigeria for surgery and other medical things. So I can say medicine has changed rapidly. The quality of medicine is much higher than it used to be, and for majority of things that patients need, they can all be done in Nigeria.
My name is Mr. O.C Nzewi, popularly known as O.C. I'm a consultant cardiothoracic surgeon, which I have been in United Kingdom at the Royal Victoria Hospital in Belfast for the past 25 years. I'm also the director of Friends of Nigeria RVH Seve Heart Foundation, which was the foundation that actually reintroduced cardiac surgery in Nigeria 6 years ago. Our activities as the first cardiology consultant started just over a year ago, and is actually the first independent cardiothoracic center that was set up in Nigeria. Attempts prior to that had all failed, and it's succeeding because we have both an interventional cardiologist in the name of Dr. Adeyemi Johnson in the center here. What we do here are all types of complex cardiac surgery, adults and pediatrics, excluding heart transplant. the list of what we've done here, which is probably the only center in Nigeria where you can get that done, include surgery, complex surgery to the ascending aorta, dissection, which we've already done 4 here. The bread and butter of the rest of what we do include coronary artery bypass surgery, which is the surgical treatment for those with ischemic heart disease. Ischemic heart disease in layman's terms is when the arteries to the heart are blocked. 2 types of treatments we can offer. We do both of them here. The interventional cardiologist, Adeyemi Johnson, can put a stent to open the blockage. And when the arteries are so blocked that the stent will not work, he will pass it on to me, and I will do coronary artery bypass surgery, for which we are going to do 2 here. Today, other surgeries we do here are complex valve surgery. We've done double valve surgeries, replacing both the aortic and the mitral. We've done single valve surgeries. We've repaired complex pediatric congenitals like tetralogy of Fallot. We've, more importantly, like I said, done few modified Bentall procedure for ascending aortic aneurysm. And one could say that by the grace of God, the program has been extremely very successful. And to put it mildly, patient coming in here for either the interventional cardiology or open heart surgery will be guaranteed exactly the type of treatment they would have got were they to fly over to see me in Belfast to have the operation. And that is the beauty of this place.